So, hi guys, welcome back to the channel. Today we're going to do something a bit different. I'm super excited for this. We're going to be kickstarting a new series of videos where we talk to different healthcare professionals and different students in healthcare. And I'm super delighted. We've got Nealy here today, who's a friend and a physician associate, and I'll put all her kind of socials in the description. She's going to be talking to us today about how she ended up becoming a physician associate, kind of her time at St. George's Uni and what her day-to-day job is like. So, Nealy, thanks for coming on today. Like I said, for like the 2 or 3 people that do not know who you are or haven't heard of you, just tell us a bit about who you are and what you do.
So, like you said, my name's Nealy. I'm actually 26, turning 27 soon. I've been a PA for almost a year now. I graduated from uni last year, and I'm currently working within a general practice. So that's whistle-stop tour of my life.
Awesome. And I'll be honest, as a junior doctor, I hadn't heard, and this is quite embarrassing, I hadn't heard of the word physician associate 5 years ago when I was at med school. But over the last couple of years in particular, whether it's in hospital or whether it's in general practice, I think I've seen a massive spike or boom in the number of PA students and the number of physician associates. Is that something you've noticed? Is that true?
Yeah, I mean, I'll speak for myself too. I didn't know what a PA was until I heard about the course. And then even when I was on the course, it's quite difficult to get your head around something that's new, that you've never heard of before. But I think the more PAs that are graduating, the more the course is being, popular and things like that. So there's definitely a huge spike in PAs, yeah.
Yeah, brilliant. Well, at least I feel a bit better now that I hadn't heard of it and you also hadn't heard of it a few years ago. Awesome. So for you, if we look back a few years ago, was there a particular moment that you can look back on and think you thought, I think I want to become a physician associate? Was there that kind of light bulb moment of inspiration that you can remember and tell us about?
So I have an undergraduate degree in pharmacology, and I knew from before I even applied to pharmacology that I didn't want to do it. It was basically my backup choice. I wanted to study something else completely different, dental materials at Queen Mary. But then I didn't really know what the career progression was with that. I didn't really know much about it. So I did pharmacology. Then when I finished, I worked in an investment bank, and I hated it, absolutely hated it. So then I quit. Then I started learning how to make jewellery. And during that phase in my life, I was quite lost. I didn't really know where to go, what to do. And then one day I actually went to the GP because I wasn't feeling well. And there was this girl similar age to me. And she was just like, oh, really keen on telling me about the PA program. And so obviously I had a pharmacology degree, so it was something relative and related to healthcare. And I went home and I did some research about it, and I actually thought, the more I researched about it and the more I learned about it, I thought, wow, it's so new, it's so dynamic, it's so versatile. You can kind of do what you want with it. And I know a PA in America, and I spoke to her, and she was a huge advocate for the profession. So I just applied, and yeah, that's the light bulb moment.
Yeah. And now you're pretty much the face of PA and PA students, I think, whether it's on Instagram.
Oh no, don't say that.
No, definitely. But that's really cool. So how kind of going and meeting someone kind of when you went to the GP surgery was really the first idea that you thought, I want to look into this.
Yeah.
Fine. So when you were there now, you go home, you do your research. For anyone else considering that kind of moment where they're maybe done a degree or they're considering kind of doing physician associate from, if that's possible, straight out of school, can you tell us a quick summary? I know this is going to be really difficult for you in terms of the rough entry requirements that someone might need to think about if they're considering this kind of option.
So currently there's only 2 universities that offer the undergraduate entry. So obviously that's just with your A levels. I'm not sure what they are. I think it might be ABB or AAB. I'm not too sure. But so there's 2 universities that offer that. And then the majority of universities and the majority of physician associates are actually postgraduate students. So you would have already been expected to have done a healthcare science related degree, so either biomedicine, biochemistry, pharmacology, anything in that, even nursing. There's like so many different ones. And there are some universities that accept a 2-2, but majority of universities expect a 2-1 in your undergraduate degree.
Fine. And okay, so that's useful. And then say someone says, okay, I think I want to do physician associate as an option, as a degree applying to that. Where do they go from there? There's a personal statement. Are there entrance exams or interviews or things like that that they have to think about?
Yeah, so the application process is actually it can be for some universities quite tedious. Some universities ask you to do 3 500-word sort of mini essays, one including your personal statement. Another one that's quite common is things like, how does a physician associate fit into the NHS? There are loads of different application processes. Each university is quite unique and individualized. And then once you get through the personal statement application part, either they'll offer you in for an interview, or you might be required to sit an aptitude test. So something similar to the UCAT, but a little bit different. So it's really independent to the universities and what they've kind of tailored for the application process.
Fine. So it sounds like it's a little bit similar. It's got differences to applying to medicine. So a lot of people watching might be dreading sitting the UCAT or the BMAT exams, but there are other steps in the physician associates that are just as hard or potentially different. So that's good to know, definitely. But I also know that you have an ebook and run some courses for kind of physician associate applications and interviews, which I'll link in the description. Definitely go check them out. And I fully recommend them. She's like literally the face of physician associates right now. So definitely go check her out.
Stop. Thank you.
Fine, awesome. So that's really good. If we now say, take you a few years forward, you've decided you want to become a PA, you've been successful, and you've ended up at St. George's, is that right?
Yeah.
So tell me a bit about generally, like, what was it like studying? How long was it? Kind of, yeah, what was a degree like?
So if you do the undergraduate degree, it's a 4-year program. And if you do the postgraduate, it's a 2-year, either a master's or a PG dip. So at St. George's, we were able to do the master's. You can choose not to do the thesis project and graduate with a PG dip as well if you want to. It's really, really, really tough. We learn about all the most common and important conditions in 1 year, essentially. So my experience at university, some were different. Mine, I did a whole year of studying and then a whole year of placements. So you go to different hospitals, you do different rotations, similar to what medics do as well. And that's how my university was organized. Some universities, you study for a bit and then you go to placement, and then you study and go to placement. But it's a really, really, really intense program. Essentially, we cover, I think it's over 800 different medical conditions in the space of 2 years, really. And then you sit a numerous amount of exams in uni. And then even after you graduate from university, you have to do a national exam, and you have to pass that in order to practice as a physician associate.
Fine. So it's got its pros and cons. I didn't realize it. So postgraduate is only 2 years. So a lot of people think about postgraduate medicine, postgraduate dentistry, which can be 4 or 5 years. This is half the time, but probably much, much more intense. Is that right?
Yeah, loads of independent learning and self-studying.
I've got a few questions on kind of the course, if that's okay. In kind of medicine, we, like you said, you have different teaching approaches where some kind of traditional unis like Cambridge and Imperial do the very much like studying, lectures and practicals, and then all the patient contact. some unis kind of integrate it. It sounds like you did more the studying followed by the patient contact. The way we learn is we learn kind of anatomy, biochemistry, physiology, embryology, and then kind of put it all together when you see patient. Maybe I'm getting this wrong, but do you guys learn it kind of in a disease-based format rather than kind of breaking it down?
That's really interesting. Yeah, so I think the biggest difference between how we study and how medics study, obviously you guys study a wide breadth of medicine, we don't, of course, but the way we learn is, you're absolutely correct. So we're very disease based, so we're trained to pick up on the signs and symptoms of a disease instead of the minutiae of the pathology and the biochemistry. We do learn a lot about pharmacology. So my university, we had a whole module on pharmacology and an exam. But yeah, you're absolutely correct. We're more trained on
pattern recognition of diseases and kind of spotting
exactly.
symptoms. Yeah, that's really interesting, because I think most medical students, especially me, when I kind of started medicine, I thought that's how we would be taught, because that's kind of seems more kind of the thing to do. But
Yeah.
yeah, fine, okay. But I can imagine it being super intense if you're learning all of that in 2 years, plus seeing patients, plus learning how to examine patients. But well done for kind of getting through it. And yeah, awesome. So onto kind of what I'm most interested about, and I think what a lot of medical students would be interested about, is one of the things that most medical students really worry about is basically when they finish their 5 or 6 years of uni, because of the way job allocation works with ranking programs, they could be sent to lots of different hospitals or practices all across the country: Scotland, England, Wales, Northern Ireland, places that they may not have ranked as highly as they want to. And location's a massive part for everyone. They want to settle down, they want to get a house, etc., etc. Is that something that is similar that you've had to think about or worry about, or is it a bit different with you guys as physician associate graduation students?
So in that sense, it's probably one of the biggest benefits is that our training program is totally different to medics, and also our post training. So once you qualify and once you're registered, essentially you can work wherever you want, you can apply to any job you want. There's no further training program. So if you want to work in pediatrics, you can apply to a job in pediatrics and you'll get it. And if the next day you decide, oh, this isn't for me, I want to go to general practice, you can do that. And you're not limited to working where you're ranked and where you're sent. It's more, you apply to the job you want, you, just like any other job, you go through an interview stage, you hand in your CV, things like that. So it's a big benefit, I guess, compared to what you guys have to go through.
Yeah, I think a lot of us, after we finish, we do our F1, F2, because our foundation year training. And even then, we're kind of in training kind of streams, whereas it sounds like for you guys, you are your own kind of PA. So you can work for someone or with someone that benefits you and wait for the ideal job if you want, or try something different, which is, I think, a real big plus that hopefully will be introduced into medicine. But I'm not sure. We'll see. I think one of the things that I'm really interested in is what your day-to-day life is like as a physician associate. I know you're currently working in a GP, so can you tell us a little bit about what your day-to-day life is like?
Yeah, so usually I start around 9 o'clock in the morning, and I have my morning clinic from 9 till about 1 o'clock, whereby I initially started off with 20-minute appointments in the first general practice I worked in, but now, and then I did a bit of locuming, and then now I'm settling down in a practice. I'm actually starting on Monday, and I will be having 15-minute appointments just because I'm going to be new there, and I'm sure there'll be so many questions that I want to ask. But yeah, I was doing 10-minute appointments last week, so it really depends on what you want to do with your appointment times and how confident and comfortable you are with the timings. So depending on the times, it will take me to about 1 o'clock, and then from 1 till 2 I'll have lunch. And then again during lunchtime, it's all we call it lunchtime because there's tons of admin work that goes on behind the closed doors in a GP that I wish someone had told me about before I chose to go to GP. But things like sending off referrals, reading patients' hospital letters. So if they've gone for an appointment for, let's say, I don't know, a colonoscopy, reading the report of the colonoscopy, understanding a little bit about what happened when they went to their appointment. So there's a lot of that to do. And then I start and resume my clinic again from about 2 o'clock till 5 p.m. Again, with appointment times that vary.
Fine. And because that seems very similar to what kind of GP kind of trainees and even GP consultants do kind of for us. Are there kind of a certain type of patients kind of that book in to see you, or is it very broad, would you say?
Again, I think it really depends on where you work and what you make out of it. So I remember when I was locuming in somewhere for quite a while, for about 4 months, I was seeing pretty much the receptionists were told to just book in anyone and fill in my slots. So I was seeing, palliative care patients all the way to newborn babies.
Wow.
But then I remember the first place I worked, they kind of asked what your special interest was. And I ended up getting pretty much all the female health patients just because I was one of the only females who worked there. And I guess at the time, I was interested in it. So yeah, it depends on you and what you want to make out of it. But also, there are some teaching GPs where they're used to having newly qualified clinicians. And so what they will do is they'll probably book you in with some simple things to start off with. And then as you gain confidence in your line of work, they'll start booking you a little bit more complicated, see how you get on, and then go on from there.
Fine, awesome. So I think, like you said, it's very practice dependent and where you kind of look for a job, but it sounds like there is a lot of variety if you want, and sometimes a bit too much variety because you're seeing a lot of kind of complex patients up to like kind of simple things and kind of very, very emergency things even technically that could come up into a GP, or if you're a PA that works in a hospital. Is that right?
Yeah, so my clinics are usually mixed between same-day emergency appointments, and then there'll be follow-up appointments. So people who maybe I've spoken to a few weeks ago and I just want to check in how they are, or patients who have booked an appointment 2 weeks ago, so advanced appointments. So yeah, it's super, super mixed, and you never know what's coming in through the door.
Fine, awesome. And just to kind of finish off, this is not going to be an easy question, so give it a go. What would you say is the best thing about being a PA? And then after that, what would you say is the worst thing about being a PA?
Okay, so best thing about being a PA is the flexibility of being able to work and rotate around different specialities very easily, and being able to experience different specialities. I know studying medicine, you guys do your F1, F2, and if you want to do F3 and things like that. And also when you're becoming a registrar, you also have different rotations, but they are a set amount and a set, period of time. So as an F1, F2, I think they're either 3 months or 6 month rotations. Am I correct?
Yes, usually do 3-4 month blocks a year. So 4 months usually, yeah.
Fine. But as a PA, once you graduate, you can choose to work in pediatrics for 2-3 years if you wanted to, and then rotate into different specialities. So that's one really big benefit. Another one is the flexibility of being a PA. So even if you work in hospitals, you can choose your shifts and choose your hours, whereas as a junior doctor, you can't. You've
got a set rota that you can.
Yeah, exactly. So one of the negatives about being a PA is probably the lack of knowledge on how your career will progress. So as a PA, once you qualify and you register and you graduate, you're just a PA. And at the moment, we're not regulated. So it means that we're restricted in being able to prescribe, order ionizing radiation. And so once we are regulated, we'll be able to progress in that sense. So our skills will be able to progress. But in terms of a solid, so with doctors and, you know, loads of other healthcare professionals, you kind of work your way up the ladder, whereas for a PA, the ladder's not really there. So that's probably the biggest negative.
Fine. Okay. Well, I think you can look at it as pros and cons. Like some people in medicine think that part of that training program is very difficult. You're kind of moving around hospital to hospital every year, but some people enjoy it because there's kind of something they're aiming towards, kind of very niche kind of specialty. But awesome. I think that's a really, really nice point to kind of wrap this up. Thanks for kind of your time, Nealy. I'm sure lots of people find this super, super useful, especially if you're considering medicine, dentistry as another alternative, or if you just want to know a little bit about kind of who you work with on a day-to-day basis, because we work with tons and tons of PA. I think that's just going to keep becoming more and more common over the next few years. So yeah, thanks so much. If anyone has any questions for Nealy, then I'll put her socials on the video description and kind of on the screen right now. But yeah, thanks Nealy so much, and thanks for watching, guys. Hope you found it useful. Take care. See you later.
Bye.
Bye.